Today we will talk to you about inflammation of joints, any, large, small. Inflammation of the joint is characterized by swelling of the joint, redness of the skin in the area of the joint, and intolerable, burning, sharp pain. Why can it occur? And unfortunately, it occurs, and often in the middle of the night in a state of complete rest. There can be several causes. The first cause is autoimmune disease, which includes rheumatoid arthritis, systemic lupus, erythematosus, psoriatic arthritis, and many others that I could list just endlessly. This is the first cause of inflammatory diseases. The second cause is the natural wear and tear of the joint. When we wear out the cartilage of the joint experiences increased friction, and the body begins to produce fluid for this friction, which then becomes inflamed in the joint. The third reason that can lead to pain and inflammation in the joints is excessive strain on the joint. Let's say you have pain in your left knee, you're taking care of it. And what do? You overload the right knee, the right hip, the right foot, because you take care of the left knee. Often, a patient will come to a doctor's office and say, "I have knee joint pain" or "I have hip joint pain." But in fact, the patient has inflamed the ligaments that surround this joint. Here is a fourth cause of pain in the area of any joint. So in order to deal with your pain, to find out the cause, whether you have pain in the joint or in the surrounding soft tissues, whether it is an inflammatory process or whether it is still osteoarthritis, wear and tear of the joint, please see a doctor. Now I want to tell you in which cases you need to urgently consult a doctor. If your joint is swollen, if the skin over it is red, hot to the touch, intolerable sharp pain, you should run to the doctor immediately. When you have the above symptoms, it is an acute inflammatory process in the joint, and the sooner the doctor removes it, the faster and better will be the healing of your joint. There are other situations when you start to whimper a little bit when walking for a long time, when you load for a long time. In this case, you should also see a doctor, but in this case, you have time. You can make a diagnosis in advance, ultrasound, MRI, and already with some diagnostics come to the doctor. Now briefly about the treatment of joints. Why briefly? Because each joint pathology has its own therapy, determined only by the doctor. Never wrap your knees or feet in foil, it will not help. So, joint treatment can be medication. What does it involve? Taking medications in tablet form, intravenous drip infusion, intra-articular and peri-articular injections, acupuncture, physical therapy, massage, manual therapy, wearing orthopedic insoles and wearing special prostheses to unload your joints. If you liked this video, please give it a like. If you still have questions, you can ask them. I will be happy to answer them. Be healthy. Thanks for watching. If you found this video helpful, don't forget to hit the like button and share it with your friends. Make sure to subscribe to the channel and click the notification bell so you never miss out on our latest health tips and tricks. Stay healthy and see you in the next video.